This is the valgus stress test and is testing for medial collateral ligament instability. So I'm going to have the patient, I'm going to straighten their elbow out, and then this hand is going to apply force lateral to medial, and then my distal hand is going to apply a force medial to lateral. So, looks like that. And then I'll bend her arm and do it again at different angles. Okay, this is the moving valgus stress test. So I'm going to place the patient in 90 degrees of abduction, full elbow flexion, and then apply a lateral force on the elbow while I quickly move their elbow into extension. So, there we go. And a positive test would be reproduction at the medial elbow. This is the varus stress test. So I'm going to have my patient, I'm going to extend their elbow, and then my proximal hand is going to go on the inside of their arm and apply a force medial to lateral, and then my distal hand is going to apply a force lateral to medial. So it'll look like this, and then we'll do it at different angles. And I'm looking for a reproduction of pain or gapping at the lateral elbow. This is the posterior lateral rotary stability test. It is mainly for the ulnar portion of your lateral collateral ligament, but also for your medial collateral ligament. And I will be looking for apprehension of the patient. So I'm going to place my patient in 90 degrees of shoulder flexion, and then I'm going to maintain my patient in forearm supination, start an elbow extension, and I'm going to, as I flex her elbow, I'm going to apply a valgus force. So, with an axial load compression. This is upper limb tension test 1 for the median nerve. So for a positive test, I'm looking for a reproduction of pain, numbness, or tingling along the median nerve distribution. So you're going to start with your patient in about 100 degrees of shoulder abduction and elbow, and then I'm going to put them in scapular depression. I'm doing this weird. And then elbow flexion, wrist flexion, finger flexion, and I'm going to move into elbow extension, wrist extension, and finger extension. Okay. This is upper limb tension test 2. I'm looking for reproduction of pain, numbness, or tingling along the axillary, musculocutaneous, or median nerves. So I'm going to start with my patient in 10 to 30 degrees of abduction. Can you scoot this way? Okay, 10 to 30 degrees of abduction. I'm going to put them in scapular depression and then do elbow, wrist, and finger flexion, and then bring the patient out into elbow extension, wrist extension, finger extension, and then provide an external force, external rotation. This is upper limb tension test 3 for the radial nerve. A positive test is reproduction of pain, numbness, or tingling along the radial nerve distribution. So I'm going to start with my patient in 90 degrees of shoulder abduction. Sammy, can you tuck your thumb in? Okay. And then I'm going to provide some scapular depression. And then we're going to start in elbow flexion and wrist flexion and move towards elbow extension, maintained wrist flexion, and ulnar deviation. This is upper limb tension test 4 for the ulnar nerve. So positive test is pain, numbness, or tingling along the ulnar nerve distribution. So I'm going to start my patient out in 90 degrees of abduction, shoulder abduction, elbow extension, and wrist extension. I'm going to depress the scapula, and then I'm going to bring my patient into elbow flexion, pronation, and radial deviation. Okay? This is Cozen's test for the ECRB. A positive test, you're looking for reproduction of pain at the lateral epicondyle. So I'm going to start by palpating the lateral epicondyle, and then the patient is going to be in wrist extension and radial deviation. They're going to try and maintain that position as I try and pull into wrist flexion and ulnar deviation. So, ready? Okay, so this is the ECRL MMT. So the way this differs from Cozen's is I've had the patient extend her elbow a little bit farther, and instead of palpating down at the lateral epicondyle, I'm going to palpate a little more superiorly on the lateral supracondylar ridge. And then the motions are going to be the same, so the patient's going to start in wrist extension and radial deviation, and I'm going to have them resist me bringing them into wrist flexion and ulnar deviation. So I want you to hold here for me. So, any pain? Okay. This is Mills' test, so I'm looking for pain over the lateral epicondyle. So I'm going to start with my patient in flexion, and I'm going to palpate the lateral epicondyle, and I'm going to move into elbow extension, wrist flexion, and ulnar deviation. We'll do that one more time. Anything? Nope. Okay. This is golfer's elbow or medial epicondylitis test. So a positive test is reproduction of pain along the medial epicondyle. So I'm going to put my patient in full elbow extension, and then I'm going to move them into wrist extension, radial deviation, and full supination. This is the third finger resisted test. So it is looking at your extensor digitorum and a reproduction of pain there or at the lateral epicondylitis. So I'm going to have the patient take their third finger and hold it up like that. Good. And then I'm going to palpate the extensor digitorum, and then I'm going to apply some pressure. Try to keep your finger there. Good. This is the elbow flexion test. So we're looking at reproduction of pain over the ulnar nerve distribution. So it's an active test, so I'm going to have Sammy flex her elbows and keep her humerus in anatomical position, and then extend the wrist. Good, just like that. And then she's going to stay in this position for 3 minutes, and we'll see if she has pain. This is Wartenberg sign. So I'm going to have the patient spread out her fingers on the table, and then I'm going to have you try to bring your fingers all together. Good. So that is a negative test. A positive test, when she brings her fingers together, the 5th digit will not come together with the rest. This is the test for pronary artery syndrome. So a positive test would be reproduction of pain in the muscle belly of pronary arteries or along the median nerve distribution. So you're going to start with your patient in elbow flexion, humerus in anatomical position, and then you are going to try and supinate your patient as you extend their elbow, and your patient is going to resist that supination. So here we go. Just like that. This is the pinch grip test. So we're going to have our patient try and touch the tip of their index finger to the tip of their thumb, like that. Can you go ahead and do that? Good. And then, so that would be a negative test. A positive test would, if the patient is unable to do that, then they touch the pad of their index finger to the pad of their thumb, like that.